the number of children contracting a serious respiratory virus is rising as parents are being urged to be aware of its symptoms. New data from the UK Health Security Agency shows cases of respiratory syncytial virus (RSV) have increased in recent weeks, especially in those in the youngest age group. UKSA data reports a 5% in cases among under 5s in the week ending October 20, compared to the week before, and a 1% rise across all ages. Public Health Scotland (PHS) data shows hospital admissions associated with RSV have increased among all ages. In the week October 9 to 15, 2023, detection of the virus has jumped from 7.9% to 11.1%. RSV in the UK leads to approximately 450,000 GP appointments, 29,000 hospital admissions and 83 deaths a year in children and adolescents. It also has a major impact on elderly adults with 175,000 GP appointments, 14,000 hospitalizations and 8,000 deaths per year in the UK. It appears that the RSV cases are following a similar pattern to last winter, which saw a higher than usual number of infections as a result of people having a lower immunity after staying at home during the COVID-19 lockdowns. According to the Doncaster and Bassett Law Teaching Hospitals NHS Foundation Trust, RSV is a viral illness that causes symptoms such as trouble breathing. It is the most common cause of bronchiolitis and pneumonia in babies and young children. With that said, parents should be on the lookout for the following signs of RSV. What are the signs and symptoms of RSV? According to the NHS Hospital Trust, people infected with RSV usually show symptoms within 4 to 6 days after getting infected. Symptoms include a runny nose, decreased appetite, coughing, sneezing, fever, wheezing. These symptoms usually appear in stages and not all at once. In very young infants with the virus, the only symptoms may be irritability, decreased activity, and breathing difficulties. Almost all children will have had an RSV infection by their second birthday, and most cases will clear up within a week or two. But the NHS advises, call your GP practice or NHS 111 if you or your child is having difficulty breathing, not drinking enough fluids, or experiencing worsening symptoms. The UKSA data also shows visits to A&E for bronchiolitis in the under 1s have also increased. Hospitalizations for RSV in the under 5s has seen more than 10 children per 100,000 of the population across that group admitted for treatment, which is the highest of any age group. Dr. Connell Watson, an epidemiologist at the UKSA, told The Sun, as expected at this time of year, we are starting to see a rise in RSV infections in young children. While usually mild, the infection can cause breathing difficulties for babies and the elderly. Initial symptoms in infants are similar to a cold, but can go on to include breathing more quickly or noisily and having difficulties eating. If your baby has a cold that is getting worse, or it is causing unusual breathing or problems feeding, call NHS 111 or contact your GP practice. As a parent, you should trust your own judgment and call 999 or go to A&E if your child seems seriously unwell, such as difficulty breathing, having blue or gray lips, or if they are floppy and will not wake up or stay awake. Join the Daily Records WhatsApp community here and get the latest news sent straight to your messages.